to Sip and Tip. As I mentioned to you in the video earlier, my first video of this year actually, I'm going to be focusing more on mental health because it's something that affects all of us in our communities. Even if it's not something that you are personally suffering from, it's more than likely that you have at least one person in your family who does not have good mental health. So today we want to explain what is it, the stereotypes, all of that stuff. And the best person to do that is the psychiatrist. You can introduce yourself.
Yes. Okay, hi everyone. I'm Dr. Fungi Mazhandu. I'm a psychiatrist here in Zim, and I'm also Gugu's friend.
Yes, we are friends. We've been following each other since junior school, aren't we?
Yes.
School. We
Primary school,
lived
high
in
school.
the same neighborhood, everything. And it's funny, you go all the way to university, you don't think you're gonna come right back to the same.
I know. But I think it's also very weird, but some of your longest friends, I don't know if you're the same, we're not the same, but as in friends who are with you as you have the foundation of growing up. So I find I have more primary school and high school friends and I'm more settled with them.
Yeah, definitely. It's like family, but it's unspoken.
Yes. So you just, it's comfortable.
So, we want to explore this topic with our psychiatrist here. Obviously, it's not every single episode from now on that will be on mental health, but a lot of them will be because it is such a broad topic. And today we're just opening up just the introduction so that we actually know what it is. Because Panama stereotypes, when people say somebody is mentally unstable or mentally ill, you think as a Zimbabwean, benzi, munanoto penga, somebody who needs to be in a mental institution. It's not always, that extreme. Sometimes it's so subtle that you won't even know unless you actually understand what the symptoms are. So what is mental illness? Doc?
Okay, before we get there, I'm just gonna say benzi, guys, that word.
Yeah.
But it's a word we all grew up with. So it's just so much in your vocabulary. But I think it also is one of the barriers to people being open about having a mental illness, because if you say it, unfortunately, there isn't a lot of vocabulary for the different types of mental illness in the Shona language, though there are people who've been translating it. So people tend to jump from, let's say, the so-called normal to kupenga. There's so many things that you've skipped along that, and there is no one anopenga. So going back to your question, what is mental illness? So mental illness is when your mental health. So mental health there is normal and abnormal. The same way you can be physically fit, physically healthy, and physically unhealthy. So there is good mental health. And then when you now say you have a mental illness, it's such that your mental health is usually dysfunctional to your life, right? So the dysfunction that we talk about in life is that you're supposed to function, especially let's say as an adult, in different spaces. So one of them is to yourself, self-care, basically, honestly, kugeza, bathing, eating, feeding yourself. That's how you function to yourself. Sleeping, those are just about you things. And then we talk about to interpersonal relationships or to others. So your relationships obviously different, and there's nothing wrong with having all of so-called relationships or some of them. So as an adult, it would be maybe as a partner in a relationship, maybe as a parent, if you're a mother or father or an auntie, all of those things. And then you're supposed to function in a capacity to yourself again, kind of, but in an occupational setting. Okay. So that's going to work or going to school. Nothing wrong with either. And then lastly, in the community. So in the community is very important because it's rule observing. So whether or not you've signed up for it as a person in your community here or in Harare or in Zimbabwe, there are certain expectations that you're supposed to do. So when you start dysfunctioning, you're doing things that are not, what the community or society has deemed acceptable, and you're doing it without accountability or responsibility. It's out of your it's not your choice. Then you're dysfunctional. So mental illness is any one of those areas. Often you find that as you get maybe sicker or the severity increases, the dysfunction may start in a community setting. and then it comes back maybe into like your work or your home, and then eventually ukazona when you have a severe mental illness, you're not bathing. Do you get it? Maybe you just were skiving work or skipping school, anything like that, but then now you don't even have energy to bath for yourself, to change your clothes, to have that self-care. Yeah.
So do you call that depression?
It isn't just depression, but one of the most commonest mental illnesses is depression and anxiety. So it is the one that you'll see more of. And because it's seen more of, I actually think then people undervalued it. People were waiting to see the schizophrenia and the bipolar. And I mean, just statistics, which I won't bore you with, but as an example, schizophrenia, we're talking about, let's say 1 in 100 or something, right? And then when you talk about depression, you can talk about 1 in 4 as in over a lifetime. And so that's quite big. So schizophrenia, it is very severe, but what's going to happen to a lot of people is depression and the anxiety and the personality disorders and those other things.
So what are like the symptoms of the most common ones, like depression and anxiety? What will a person be doing, or how do they behave? What do they sound like for you to be able to tell for yourself that you are depressed, and for you to tell if the person next to you or your loved one is depressed?
Okay, so I'll start with, if it's for yourself, right? You're looking at certain symptoms, like I said, and sleep is one of the most, mood is the most important. So your mood, which if you're depressed, it's often you're sad. But the other one that people don't often expect, but it happens a lot, I always think, especially in a, like African mama context, is irritability. Like, growing up, I just noticed like aunties and, moms and stuff, when they're sad, it's not like they're going to be like sitting in a corner weeping. They've got things to do, but they might be more irritable, snappish, short-tempered. So that is what a person can experience. Like people just irritate you. That can be depression, not just excessive sadness. And then you find your sleep is affected. So either your sleep is increased, where you just want to stay in bed and sleep, or more commonly you can't sleep. But it's not productive can't sleep. Like, oh, I can't sleep, let me read this book, let me read for school, let me write an essay. No, it's I can't sleep and I'm just lying there.
Okay.
Yeah.
You said, and it's also like not bathing.
Yes.
You said also things like not wanting to be around people.
Yes, you find you withdraw. So there's a lot of social withdrawing, and then there's reduced interest. So in your pleasurable activities. So there are things I like to do. If I'm not doing them anymore, then I should worry about me. That's why I said it's looking at yourself, because we have different interests.
So lack of motivation.
To
do what you love doing or what you normally do.
Yes. And then you find as well that with some people, they have a reduced self-esteem. So low self-esteem, you start doubting everything that you do. One of the symptoms I think for myself when one is depressed that are painful is the inability to make a decision. Because so you do nothing.
Yeah.
You see, it's like decisionless, and worthlessness, and you have reduced hope, and you don't feel anyone can help you.
What about paranoia? If you find that you can't trust people, the people that you used to talk to, the people that nothing necessarily has happened, but you've now sort of isolated yourself and like, I can't talk to this person, or I can't trust this person, or I can't, and then the people who are used to you as, I'm always talking to him, or every once in a while I talk to her or him, they find that Fungi doesn't talk to me anymore.
Yes.
And you don't know why she's not talking to you, because you didn't fight or anything. So is that a sign as well?
Yes, it's a sign that can be on different parts, because if you are feeling low self-esteem and you're doubting yourself, you're going to doubt yourself with respect to other people, right? So I'll feel like, and maybe the thoughts become, they don't like me, or I'm not good enough to be amongst them. And that means I'm going to turn inward and get anxious about being in a social setting. But then you also find in another part, when somebody is depressed, so these are symptoms a person can feel, but we don't know somebody's thoughts, right? So the only way to see somebody's thoughts is their behaviors and how they speak. So when somebody is depressed, they start talking in like very low tone, and poverty of speech. They don't have a lot of words. Fine, I'm okay. Not even with that.
Poverty of speech. That's
what it's called though. Poverty.
Really?
Yes.
That's a term.
Yeah, that's the term.
Is that a clinical term?
It's a clinical term. Poverty of speech.
It makes sense because sometimes you may have certain people in your family or members or friends or whatever, and they can be that person who, when they text, and they don't even really talk like this when face to face, it's like, hey Google, how are you? But sometimes when they text you, it's like you say, hi, how are you? And they're like, fine, good, what's up? And it sounds snappy, and you're like, why is this person sounding like that? And then, no, I'm cool, I'm just checking on you. Great, I'm good, thanks. And you're like,
what did I do? You see, so the other person will say, what did I do?
Or you may think, Kuti, this person is being mean to me, they're being unnecessary, they're being snappy, but that's not always the way to look at it, right?
It's not always, because people are going through what they do. So that's why it's important, because already WhatsApp doesn't exactly have a lot of context or emotion, right? But people say that, but over time you get somebody's specific texting style, like you're saying. So it's not as cut and dried. Yes.
When it
so when you see that, I find it's important to see clarity. Okay, or have a phone conversation where you hear somebody's voice, because just relying on that, you will also be like, Monday, Tuesday, 2 weeks, I'm okay, right? And then people like lately love this I'm okay thing, I can move on. And then you leave somebody who might be in distress. So it's worthwhile to just follow up and see. Yes.
Exactly. So the point of this is so that you understand the signs, and because they come as subtle signs, or they come as and we want to remove that normalizing. Some people act strange and nobody just acts strange for no reason. If there is a problem with the way someone is communicating, or the way they're talking, or the way they seem so isolated or whatever, remember that there is a thing called depression and anxiety, and maybe they are actually crying out for help.
And you said something very important, because there is personality. So maybe that person doesn't, roll with you like that, or they're always quiet. But it's the change, you're saying. So it's always from this functioning to what's happened now. Like I'm generally sort of a loud person, or I engage. So when I'm not like this, then people will check in. And sometimes I'm just like, nah, bro, I'm just busy. It's actually okay. I'm not going to be upset about somebody asking. And I think also now it can make you also less excessively sensitive to when people ask you.
Exactly.
Because we don't know your thoughts.
And you see, asking is also something that will actually let you know the way they react when you ask them. Because if you are genuinely, this is somebody who knows that you care for them. When you're genuinely asking, Kuti, you're sounding a bit different. Is everything okay? If the person says, great, thanks. Do you know what I mean? That is a sign.
And it teaches us how also to respond, so we don't worry people. Like, I know if I'm busy.
How do we respond?
Well, if I'm okay, if I'm genuinely okay, I will say, I'm busy. I'll try and get back to you.
But how do you respond as
when I'm not
someone?
Okay?
Yeah, I'm your friend, and you are the one who's depressed or anxious, and I can tell or I'm suspecting that you may be, because of the way you are texting me, the way you are sounding. This is not like you. And then I'm like, you're actually not sounding like yourself. Is everything okay? And then you're just like, great, no, fine. And you are responding in such a way that I'm like, something has changed. What then do I do?
Yeah, it's tricky, because people are different, so we respond differently, and it depends. Like you said, we're friends, right? But on the nature of your relationship with that person. So I find that when I'm not doing okay, I will say to people that, I'm not doing okay, but give me time. I'm dealing with it, because it's allowed.
And that's the best thing. That's the best response to give, because people know.
Yes, that I'm dealing with it, or I'll get back to you, and
they know it's not personal.
And you can check in with me later, or maybe if I do need extra help. Because another thing that I find now with mental sort of health being an important thing, it always was, but being more in the spotlight, let's say, is that there's a spectrum of emotions. Do you understand? There's mental illness, and remember, I defined that a lot of it is now when you're dysfunctional. So I could have me a bad day. I do. But when now I'm having a bad almost weeks and I'm not going to work, I'm not answering my phone, and this is my job, that's my livelihood, that is a problem. That's the dysfunctionality. But if you happen to have found me on a bad day and I'm saying I'm okay, tomorrow will be better for whatever reason, there are a lot of psychosocial stresses. Personally, there are also hormonal reasons and things like that, physical reasons. Then you don't have to think that person has a mental illness, because the spectrum of emotions is still normal. It's still allowed: happiness, sadness, anger, frustration, but it's still that, is it affecting you entirely? Like, even if I'm frustrated at work, there's a way I'm going to react so that I still keep the job with my frustration. But then when your frustration, the way you now express it, we are now worried because it's not in keeping. So we must allow the right to have, different mental spaces. But it shouldn't be so open that we forget that there is the deviance from being normal.
So would you agree, what are the statistics to say? Because, some people may be listening and watching this and being like, they don't think they've ever known anybody with mental health. There's a lot of people who may also be like, we don't really get affected by such. What do you have to say to that in terms of the actual proof and stats, Kuti? This is how many people are affected by depression, even in Zimbabwe.
Okay, so the statistics in Zimbabwe, we don't have them on me right now, but I'll say that they are comparable globally, and they're comparable across races. And they are comparable across sort of gender. There are some mental health disorders that have differences in gender. I will give, for an example, dementia. Dementia affects women more because the bulk of the type of dementia, right? This is a word I struggle to say, Saka. Here we go. I'm scared.
Go ahead. Most of us probably will not even know.
Alzheimer's. I think I got it right today. If I got it wrong, it's okay.
Alzheimer's.
I used to call it Alzheimer's for a long time.
Okay, that's
You said it was okay.
No, we all have different pronunciations, and you know what? I'm sure you're not the only person who pronounces it like that.
I did it until one medical student that was giving like my online lectures, and I was like, Alzheimer's, what? It's like, excuse me, Dr. Fungi, is that how you say it? And internally, I was thinking, if you know how you say it, say it for yourself. It's like, you ever say it, wake up and run with my knowledge.
It's a difficult word.
It's a difficult word.
I think what I've heard is Alzheimer's or Alzheimer's.
That's what I know. I get it twisted. Just like anxiety, but knowledge is that the degree is there.
No, we trust you.
Well, okay.
Dog. I trust you.
So there are things, like I'm saying, with that dementia is more in females. There are things like depression, right? They are seeing it more expressed, like men are coming out and we're seeing a lot more depression in men. It's not to say things weren't there, right?
Because the stats apparently are always high for suicide when it comes to men.
You see, but higher suicide. So you see, Kuti, then you say that we are not saying that everything absolutely is the same in every area. But those differences don't take away from the fact that mental illnesses in African or Black populations are comparable to white populations. Financially, right, I will say there are disparities within a sort of financial bracket. There's things that money almost can seem protective of. It's not necessarily protective in that if I have much money, I will not have a mental illness. It can seem protective in that some psychosocial issues that lead to depression, like loss of a home, loss of your health. So these things increase the chances of depression.
Funerals, like deaths.
Loss of home, loss of health, loss of finances. Obviously, there would be less in somebody with financial means, but equally, somebody with more financial means, right, might seemingly have better health seeking behavior. If you've got great finances, maybe you've got constant medical aid or just constant resources to use even without medical aid. Unlike a person who might have insight that they're not feeling well, they have depression and things like that, but doesn't have knowledge or access. Access, not just Kuti, the hospitals for access, like money, like the hospitals there, but I can't afford it. So it's not that they're diseases of the rich, it's that maybe people of a wealthier setting in certain economies or environments where there isn't free healthcare. Yeah, maybe if we had free healthcare in Zim, we could all access it. But it's become that people think that way. Yeah.
So, it is obviously unfortunate that somebody may even be able to tell that they are not okay mentally. But like you said, they're in Zim, they're jobless, how are they going to even start getting help for themselves if they can't even afford to, and the people around them may not even understand or believe the mental health problem that they have. So if I was in that situation, Dega, I don't have a job, no one in my family has even been diagnosed of mental health, and they don't even know that this thing actually is real. If I am in that situation and I'm realizing things are not normal, I'm forgetting things, I'm not happy, and I do just have a feeling that mentally something is wrong, how do I help myself in this country, in this economy?
Okay, so I'm not trivializing that. Even when somebody says "Andinamari," somebody else can be like, but when you are die, meaning kuti, you can never fully understand a person's situation, firstly. But there are resources that you can get that are free, right? But nothing is free in that sense. Because free, when I say kuti, there are call centers, though there's a call center that is a free, toll-free call center, right? I'll give Google the details afterwards so she can put it there.
Yeah.
But then somebody will definitely, you say something, this not gonna phone, kind of date, and I'm agreeing. Auntie, there are things like the friendship bench. This is an amazing thing. I always want to talk about it. But the friendship bench was actually started here in Zim by Professor Chibanda, right? Professor Dixon Chibanda, one of my mentors and sort of people who taught me. And basically, they have done it so that they are teaching lay people. What we call lay people is people who aren't in the medical profession. So lay people in different areas, high density areas, say Highfields, Glenora, different areas. And it's called friendship bench because there's a bench and there are people who are able to listen and know whether you need to upskill the services you get. See a psychologist or see a psychiatrist. So you get first contact. There's somebody who can listen to you, who knows how to professionally listen. Because listening isn't always your friend. That person isn't removed from your situation. The person may want to give advice, which is not professional listening, Auntie. So there is that Access Friendship Bench. Like I said, the toll-free numbers, which I'll give Google, right, for the call center. There's also Christian counseling. There's a whole host of different areas. There's Harare Hospital, there's perinatal hospitals, and generally you will get care at any government institution.
Okay, so they will get care. So there is help that people can get regardless of their situation and finances and all of that. So we will obviously make sure that that information is available for you on the screen. And each time we discuss this topic, as we go further and further into it, we'll always put the information up there for you because it is real. And as we said, it's very different stages, very different levels. And
yes.
And kuti someone is mentally ill, ashireve kuti ibenzi. We said that, and that word is thrown around so loosely in our society.
It is, and it takes people back from accessing care because I mean you're so afraid kuti unzi benzi that if you started feeling like okay by yourself, maybe I'm excessively sad, maybe I'm even hearing voices, or I feel like I'm seeing things, or I feel things are so real because you can get those feelings. You're afraid to say it because somebody's already concluding. Yet mental illness is a diagnosis, right? So for you to, even if you went to the doctor and they said you've got a fractured leg, or they said you've got pneumonia or heart disease, beat 5 times and I don't know what I need. So it is a diagnosis, and there's way to make the diagnosis. And the nice thing is, once something is diagnosed, often enough there is some form of management that comes with it. So there are ways in which you can be helped so that you remain a functioning adult or child or teenager. I just assume adults, but teenager or child, so that you can continue your life the way it's meant to be.
That's so important to know. And we will, as I said, continue this topic. I would like to personally know, even just as Christians, sometimes I found that people don't know how to separate the two kuti, is this a demonic attack or is it mental illness? That's something that Christians struggle with a lot. So I think in our next discussion, we'll talk about that. And we're also going to talk about just all the different stages of mental illness, so that you know, kuti, you know, what stages are there, and you know, if you have it, what stages you're on. And most importantly, we all know, kuti, just because someone is mentally ill, it doesn't mean they need to get locked up
or removed
from society, or, you know, kudaidzirwa, you know, a van that's going to take you away. Because if you're suffering from mental illness, imagine someone who's suffering from mental illness will have all these fears. If I admit or let people know that this is what I'm going through, are they going to lock me up? Are they going to take me away from my family, from the people I know? So it is important to share this information, and I'm so glad that Dr. Fungi is here.
I laugh every time you say Dr. Fungi.
You know, you are a doctor. So thank you so much for listening, guys, and I look forward to us unraveling this more and more, and most importantly, I look forward to all the help that people are going to receive as a result of these shows and a result of our wonderful doctor here.
Thank you very much. I am excited. I will come back for other programs and, you know, hopefully answer the questions that you have, or demystify some of the sort of myths that a society has, and see also, like what you were saying, how mental health is placed in the field of your cultural context, your religious context, your spiritual context, because you don't separate a person.
Yeah.
It's the same way that I think a very important thing to look at also is how mental health places with your physical health.
Exactly. So we will put all your information there. Get her information if you do know somebody who does need therapy or counseling. Fungi's contact details are there, Dr. Fungi, and you will be able to get the help that you need. So, and remember, even if you can't afford it, there are services available, and we are putting those services there on the screen for you to get the help that you need. Whatever background or financial status you have, you will be able to get help if you are suffering with this problem, or if you will be able to give help to somebody who you know is suffering from mental illness. Thank you. Thanks for watching.